If you've ever suffered with elbow pain, especially elbow pain on the inside of the elbow or the medial aspect, you may have experienced a condition called golfer's elbow or medial epicondylitis. Hi, I'm Dr. Joe Sturges, and I'd like to take a moment today just to give you 3 things that you can do on your own at home to help your own case of golfer's elbow. Exercise number 1 is to stretch these forearm flexors out. So one of the easiest ways to do this is to simply take the arm, straighten out the elbow, and then pull the fingertips back, feeling a nice stretch through the forearm area. I can go elbow up, same thing, just like so, feeling that nice stretch through the forearm area. A third way to do it is to actually use a countertop or a table. Again, flatten your hand onto the table and simply just lean back, feeling that stretch all the way up into that inside elbow area. Exercise number 2 uses a dumbbell. And for this one, we don't need heavy weight. Maybe a 3 to 5 pound dumbbell is absolutely fine. And what we'll have patients do is either stand or sit next to the kitchen table or maybe the countertop. We're going to grasp the dumbbell, support the forearm on the table, and simply flex the wrist up and then down, up and then down. For this one, I like to do high repetition, maybe 20 to 50 repetitions at a time, just one set, but maybe multiple times a day. The third exercise, which is beneficial for golfer's elbow, is to use one of these tools. This is a squeeze ring. You can also use a squeeze ball, would be fine. And what we're simply going to do is take a hold of that tool and give it a good squeeze, hold for a few seconds, and relax. Again, squeeze, hold for a few seconds, and relax. As I do that, I'm working these forearm muscles. Again, maybe one set, 10 to 15 repetition is good for that. If you find that these home treatments aren't quite enough to get your symptoms under control, feel free to give us a call here at Sturges Chiropractic and Sports Medicine. Golfer's elbow and tennis elbow are 2 of the most common things that we treat. Thank you.